Good day everyone, my name is Konstantin Krychtiuk from the Medical University of Vienna and member of the Young ACA Committee of the ESC. I'm standing here at the ESC conference with Christina from Copenhagen, Denmark, which has presented a very interesting abstract on the incidence of MI in patients with atrial fibrillation according to treatment with vitamin K antagonists and aspirin. Ms. Lee, could you please summarize your main findings in a few sentences for our viewers?
We looked at the myocardial infarction risk in the primary prevention, and we found that compared to warfarin, aspirin-based antithrombotic treatment had an significantly increased risk. And we also found that adding aspirin to warfarin increased the risk of myocardial infarction compared to warfarin, and it also increased the bleeding risk.
Those are very intriguing findings. What was the prevalence of stable CAD at baseline? Did this influence the choice of treatment regimen or not?
Since we looked at primary prevention, we excluded patients with prior coronary artery disease and other known vascular diseases, and therefore the prevalence was 0 at baseline. But during follow-up from 1997 to 2012, we had about 6,000 myocardial infarctions.
And according to your abstract, approximately 45% of patients did not receive any form of treatment at baseline. What was the outcome in this patient cohort in respect of MI?
Compared to warfarin, they had an increased risk of myocardial infarction.
Okay, were there any patients on dual antiplatelet therapy instead of VKA?
We did actually look into that, and yes, they were, but we did not have enough power to do the analyze.
Okay. And as aspirin is the cornerstone of treatment of stable atherosclerotic disease, it's intriguing that addition of aspirin to VKA or aspirin alone increases risk of MI in your patient cohort. Do you have any explanation for that?
No, we don't have quite a mechanism, but we do believe that there's a connection between atherothrombosis and atrial fibrillation patients because they have an increased risk of myocardial infarction, and they might share some similar pathogenesis.
Okay, thank you for sharing your exciting findings with us, and goodbye.